it's an interesting song and dance between too much high estrogen, not enough estrogen, because now we have serotonin low, melatonin low, but we have high estrogens. Now we have histamine that makes us more painful, more achy, we don't do as well, and we're awake at night because it's a stimulatory.
And then if we add to this mix an actual musculoskeletal limitation.
Oh yeah, let's not forget we have structural stuff going on too. When someone comes back and says, guess what, I slept through the night. Let's go.
Yeah, even though a lot of the women have maybe limitations for years and years, it doesn't have to take a super long time for them, especially just like the sleep aspect of it, to feel better, as long as we know like kind of where we're starting and how to put each of those key pieces together. So that's also providing, hope and just like a little bit of, I think, excitement for the women. We're like, oh my gosh, I slept through the night. Okay, this is telling me this is possible. Like I can actually do this. Here's proof of it. And then that momentum helps as well. Hello and welcome. Thank you for joining wherever you are today. We are talking about why so many women can have difficulty sleeping, especially when they have hip pain, whether that's falling asleep or staying asleep or just not feeling rested in the mornings after sleep. So we get to dive in and talk about some really fun, important things. I'm Dr. Jess Warnke. I'm the founder of Pace Physical Therapy and the Healthy Hips Formula. And we help active women that are really struggling with chronic hip pain and pelvic floor dysfunctions get to the root of what's keeping them stuck so that they can get back to moving and living life the way they want to. Today, I'm joined by one of our amazing providers, Molly Ressler. She is a pelvic floor physical therapist. She's also a functional medicine practitioner, and she supports our clients in so many important ways with the pelvic floor itself, hormonal health, gut health, nervous system, so many amazing things. So Molly, I'm really glad you're here because I feel like the work you do with our clients not only is so different than the typical mainstream things that people try, but it really helps figure out those underlying pieces of what could be going on or what's been missed in a lot of the women that we talk to or treat that are really struggling with these chronic hip symptoms and sleeping limitation.
Super excited to be here. It's actually my favorite part of working with the women because they come in thinking it's just their hip and they come out on the other side really learning, knowing, and understanding all the components that go into their hip pain and why they're not sleeping and why that's frustrating from a hormonal, from a nervous system standpoint, from histamines to everything that keeps us awake at night. And we're not just our hip pain. We have to be able to sleep and recover and have hormones that are balanced in order to be free of pain.
So Molly, we often hear from so many women that sleep becomes a problem alongside their hip pain or their pelvic floor symptoms, like needing to wake up in the middle of the night to use the restroom. From your perspective, what's actually going on there? Like, why do those things tend to show up together for so many of the women that we meet with?
Yeah, great question, right? It can be really multifaceted and so many different avenues to take. But in general, with the women we see in the program, it can be anywhere from, right, pain wakes them up in the middle of the night because we have something musculoskeletal going on that really is truly musculoskeletal, whether their bursa's inflamed, whether their hip joint just doesn't like to be in one position for so long. So we address those type things. And definitely with the women we work with, maybe we need to work on some positional changes during the night. But then we also have a gamut of women that are perimenopausal and they come in, or they don't know they're perimenopausal because they're early 30s. And now we've got some hormone disruption that's happening, and maybe we need to work on some sleep support from that place. Women in our program also are in the heat of menopause and perimenopause, and we know that estrogen and progesterone play a big deal in that age group, and that's fun to unpack some of those estrogen and progesterone dynamics in that. So we work with that. And then some of my favorites are the women that come in doing so much during their day. They're running around, they're chasing kids, they're running. I got to run, I got to do my 5 miles. And they come into the program not sleeping well at all. And that's the nervous system dysregulation when the cortisol's high and we just can't calm that down at night, plays a big role in sleep disruption and nervous system dysregulation. So fun. All of them have their own challenges, but yeah, it's fun to get to the bottom of what really is the sleep disturbance, what really is going on.
Yes, absolutely. And I'm glad you hit on some of those points, because I think for a lot of women, they're not actually sure what's going on from like a hormonal standpoint or like a tissue standpoint. Even if they've had the images or the lab work, it's like what they're feeling or how it's presenting isn't matching up with what they're finding or being told. Right. So that indicates, hey, there's something deeper. There's another connection going on that we have to further investigate. And then it's also interesting, and I can relate to this, just being that busy, business owner or, go, or high achiever throughout the day.
Yeah.
At night, it's so hard to actually wind down, turn the brain off.
So hard.
And, we've tried out, use the blue light glasses. We're stopping the technology, a couple hours. It's like we're checking all the boxes and trying the things that are supposed to help. Mm-hmm. And maybe they do a little bit, but there's still some disconnect of either the quality of how we feel in the morning or just being able to easily fall asleep and stay asleep throughout the night without disruption. And so again, I think so many of us can relate to this. And so if we've tried the basic things that are supposed to help, where do we go next? Or what else could be maybe missing that we want to kind of piece together a little bit? Right?
Yes. 100%. Yeah. It's fun to unpack all that.
Absolutely. And I think for a lot of the women we work with, they'll either like wake up in the middle of the night, sometimes with pain, sometimes with urgency or bladder types of issues, or just feeling on. And I'm curious to hear kind of like how you differentiate what could be causing like the reason for them to wake up. So maybe if you can speak to that a little bit, because I know some of the questions I'll ask women is more along the lines of like, is it like a consistent time of night that you're waking up, or a consistent time after you've gone to bed that you tend to be waking up? Or is the pain itself actually what's waking you up versus you waking up and then realizing you are in pain or that you have to use the restroom, but that didn't actually wake you up, something else did, So yeah. I'm curious to kind of hear your thoughts on that.
Yeah. Oh, such good questions. And getting to the root of that, right, is the pain waking you up? Okay. If pain is actually waking you up, that's a very different presentation to me than you wake up and then you're like, oh, okay, maybe my hip hurts a little bit. And now you start thinking about it. Yeah, my hip is waking me up, and you start rolling around, and now the nervous system cortisol is back turned on. So those questions are important to figure out. Is it truly pain that's waking you up? Okay. If it is, where do we go that can be a couple different things that people don't realize too, that pain receptors or feeling pain at night can be very common because naturally cortisol decreases. And cortisol is it keeps us in check during the day. It's an anti-inflammatory. It makes us feel less pain during the day. So at night, sometimes our pain is higher because our cortisol is dropping at night. So that we can work through that a little bit. The other question, right, like you asked, now are you waking up and then noticing pain? Or do you then have to go to the bathroom? Is that a nervous system? What time of night is that happening? Is that you can fall asleep really easily, but then 2 or 3 or 4 in the morning every night you're waking up at the same time? That also can be some cortisol dysregulation just from a very heightened nervous system sympathetic dominance. Most people have heard fight or flight response. Like if you're running all day long, even if it's all all good things. You're chasing kids, you're going to activities, you're doing your own, you're turned on, like you said, very high achiever, business owner, or you're at work all day, but yet here you're waking up at 2 or 3 in the morning every single night. That can also be cortisol that is coming up too early in the morning, because why naturally would the body allow you to sleep deeply and soundly all night long if it thinks it's running from the tiger? It's only going to let you sleep 4 or 5 hours before it goes, oh, get up. You got to get up. You got to go. So timing's important. The questions you ask, the bladder, right? When we wake up and we think we need to go to the bathroom every morning at 2 a.m., that can be so many different things. It can start to be habit, but it can also be the nervous system, the pelvic floor. When there's more nervous system involvement, the pelvic floor is tighter. That gives signals to the bladder that it's not calm and not regulated, and you need to get up, and then you need to go to the bathroom. So the bladder awakening can be a complicated one. Timing, understanding the real pattern, definitely. Turning that on is good. What thoughts do you?
Yeah. And I feel like, because oftentimes when I'm meeting with women, or whether they've already been working with us and it's something that gets brought up after the fact, or it's something that I'm asking early on just to see if we could potentially be a good fit to help them.
Okay.
Sometimes the bladder limitations, like the urgency at night, or feeling like, oh yeah, I've been doing this for years. I wake up once or twice a night to go pee. It's just part of aging, or it's just, because I'm perimenopausal. And it's almost, for a lot of people, they're common. So they're like, okay, this is normal. This is just what happens. And they don't understand that this is actually a symptom of their body trying to communicate there's something else going on, because we should be able to sleep through the night without our bladder waking us up, without waking up and then feeling like we have to use the restroom. So I think even just from an awareness standpoint, that's a huge missing piece that a lot of women just don't fully understand, or they accept as normal because it's just easier to wake up, pee, and try to go back to sleep than it is to try to solve the problem.
Absolutely.
But you then bring in actual pain, or, the hormone changes and things like that. And it's like, okay, so now all of these symptoms are feeding into one another, and it's making it harder and harder for that body to actually feel like it's getting that restorative type of space in the day, right? We need that sleep to kind of reset the systems, to feel the calmness, the rest, the restoration, so that we can perform and use cortisol, for example, in its due diligence the way we want to in our waking hours.
Absolutely. Right? Yeah. And I would say cortisol dysregulation is probably one of the biggest. I mean, it influences how your kidneys put out a hormone or a modulator called vasopressin, that your kidneys are supposed to give you that during the night to decrease the amount of urine you're making so that you can sleep all night. Well, what controls that? Oh, cortisol. So if your cortisol is dysregulated, okay, the more you make, the more vasopressin you make, the less the less urine you're supposed to make. But if you have high cortisol going into the nighttime, it tells that hormone, that vasopressin to be lower. So now we are making more urine at night. So many things come back to how you're regulating your day and your adrenaline and your cortisol. If you're turned on all day long and never get rest time and never get a break, it affects everything into the night. I think cortisol is one of the biggest regulations.
Yeah. Another, I guess, piece I want to bring up here is also the influence of just the neuroplasticity, right? Or like the patterns that the brain is now learning because of the body's sensations, or what signals are being fed into the brain. And obviously a lot of the women, if not all of them, that work with us have some form of like long-term nagging dysfunction, right? It's in that chronic state. It's no longer an acute little issue or injury. And sometimes it's just been ongoing for months and months or years and years. Sometimes it will get better in certain cycles and then flare up again, and there's not really a cause. But I think when the body has been dealing with those extended long-term types of cycles, the brain now expects to either have trouble sleeping or wake up at night
100%.
or, it's just that loop that then we get in our head in that way when we're in it.
Totally. It is so challenging, isn't it? Yes, because now we have a pattern.
Yep.
Now it's like, oh, yeah, I expect to wake up at 2 a.m. And the brain's like, yeah, girlfriend, get up, go to the bathroom. This is our normal now. And now we got the neuroplasticity. Not only does the cortisol still dysregulate, but now we've got the patterning. So it's so fun to work with these type of presentations with our women and to have them not only learn the nervous system piece, what is the hormone piece, what is this, but also the neuroplasticity that we get used to getting up to pee. Yeah.
Yep.
Our body's used to it, but it shouldn't be happening. It's not normal.
Yeah.
And no. Get better.
Exactly. And that's the beauty of it. Right. And that's, I think, why obviously we look at so many different pieces of that holistic person to understand, okay, what's going on independently in different ways? And then how are they all connected deeper? Because we can't just treat one or two little blips of it and expect the problem to be solved. We actually have to understand how to calm each of the areas down, for their respective reasons, but then also how to put that all together so that they can build a different type of pattern, right? Gain a different type of resilience to be able to have the capacity to fall asleep faster, stay asleep longer, feel rested when they wake up.
And everybody's so different in that. And so many women we work with are layered. Okay, they're perimenopausal. Now we've got the neuroplastic. They're used to getting up to pee at 2 a.m. They have low progesterone. They have the estrogen, and now they have the pain response, also the structural or the pain part. So unwinding all those patterns for each of the people we work with it's fun. It's exciting. It's challenging. It's all the things.
Yes. Yeah. And it's different from person to person.
Oh, yeah.
It's not just like, okay, you fall into this little checkbox category. Awesome. Here's what you're going to do. And you'll be fine in a few days or a few weeks. Mm-hmm. It's like an evolving process that we're monitoring, tweaking, adjusting, implementing something new once they hit certain benchmarks, right? So it's that like understanding what each person's body is trying to communicate and then teaching their body and their brain how to speak the same language together so that they can just learn it better.
Yes.
Right?
Yes. And the more the women that come in with that open mind and come in and are coachable to the little processes and bring those little problems, like this might not seem like a big deal to you, but X, Y, and Z happened. Oh my gosh, yes, that gave me so much information. Okay, now let's try this. Like it's evolving and it is one step at a time, but it works and it's fun and the results are awesome when someone comes back and says, guess what? I slept through the night. Let's go.
Yeah. Yeah. And I feel like even though a lot of the women have maybe limitations for years and years, it doesn't have to take a super long time for them, especially just like the sleep aspect of it to feel better, as long as we know like kind of where we're starting and how to put each of those key pieces together. So that's also providing, hope and just like a little bit of, I think, excitement for the women. We're like, oh my gosh, I slept through the night. Okay, this is telling me this is possible. Like I can actually do this. Here's proof of it. And then that momentum helps as well.
Yeah. And bringing down the frustration, like even just understanding, like this conversation we're having about, even if you understand cortisol, oh, okay, I had a super stressful day today. I was running all day. I didn't get my breathwork session in, or I didn't give myself time for joy and a little bit of slowdown, a little bit of peace. And I had slept really good for 2 nights. And today that day was like, okay. And I woke up at 2 a.m. Instead of being frustrated or not understanding, you go, breathe. Okay, this is why I woke up at 2. I had a stressful day. We start putting those pictures together. And when we understand what's going on, it gives our body a little more space for healing instead of just tail spinning and just being so angry at what's happening.
No,
It's fun.
it's very fun. And I think with any type of like chronic pain or like long-term condition, a lot of the protective mechanisms that come through from the brain are fear-based.
Oh,
And the brain doesn't like uncertainty. It doesn't like the fear or the apprehension of what could be or what is going to happen. And so when we can start to give somebody clarity on what's going on and why, and then also, okay, here's the tool to use in the minute you have it, or in the moment when you're dealing with it, it's almost like, okay, they can start to like retrain their brain in that environment. So it no longer becomes this long drawn out thing or something that they're maybe working on cortisol for in the daytime to like, okay, I'm going to do my breathing, or I'm going to go to yoga or do whatever it is to help me feel calm. Like that's a very, very different conversation than actually rewiring and using some of these tools in the moment to help the brain process this type of information in a more accurate way overall.
Absolutely. 100%. Yeah.
Yeah.
Yeah. It's fun to figure that out.
It is. It is. Can you speak a little bit more to like the estrogen versus the progesterone type of influence? Yeah. Especially, perimenopause, menopause obviously is really common in our population. But just because we know cortisol obviously now has a more influential role in a couple of ways, how do these other two key hormones affect sleep?
So fun. Okay. So, right, progesterone, most women have heard it's a calming hormone. It's the rest and regroup and be able to sleep. But estrogen plays a huge role in that too. And I'll go into that in terms of having high versus low estrogen can be a very different presentation. And we know during perimenopause and menopause, especially perimenopause, estrogen is fluctuating so much. It's going high, it's going low, it's all over the place. But that also affects then progesterone. So when the women come in, if I get more the presentation of I just feel anxious at night, I just can't calm down, I can't calm my brain, I can't get to sleep, I immediately think, oh, okay, talk to me about progesterone in your life. Do you have HRT? Are things going on there? Have you been talked about this before? And some have, some haven't, but progesterone is kind of that calming because it has the ability to influence the GABA receptors. And our GABA is our calming hormone system. It's what calms us down at night. And then estrogen works very different in that most women, if they are like, oh no, I fall asleep pretty well, I can stay asleep. I fall asleep well, but I'm not staying asleep and I'm waking up in the middle of the night. Okay, is that what we just talked about, more sympathetic dominance and cortisol? Or do we have a estrogen component because the estrogen actually allows us to sleep longer and better at night because of its relationship with histamine actually and serotonin. Because most women don't realize that estrogen, the more estrogen stable we are, the more estrogen we have that's balanced, actually creates serotonin. Serotonin then is the precursor for melatonin. So if we are not having good levels of estrogen, or they're doing this type of presentation, our serotonin levels then go down and therefore our melatonin. So we are not staying asleep at night. We are waking up at 2 or 3 in the morning due to estrogen. We also aren't very nice to our spouses or our people because now our serotonin's messed with and we're not quite as stable mentally, emotionally, and we might feel really out of control or really just not very nice. So if women in the program come to me with more of that, I'm not really staying asleep, but I can fall asleep. All right, let's look, what's estrogen doing? So I have that conversation with them around the serotonin estrogen dance. Another interesting thing we talk about is that like 10 to 15 years before you're menopausal, progesterone is tanking. So now we have this decrease in progesterone, but maybe we have a rise in estrogen. So now we have this fluctuation of high estrogens, but low progesterone. And that high estrogen can also lead to higher histamine. So now we're talking about histamine. And a high histamine is stimulatory and wakeful. And it's what keeps us going during the day. It turns on our brain. Histamines get high and we're more awake. Well, if we're not being balanced that out in the evenings or during the day with cortisol and progesterone, now we've got these histamine levels off the chart. Well, histamine also makes us more painful. So now we're not only painful and waking up, we're not only waking up, we're painful at night because histamine makes our pain receptors more responsive and more painful. So you can see there's so much going on in terms of what the questions I ask the women in our program, how they're presenting, where they are in their journey, where they are in things. But yeah, it's an interesting song and dance between too much high estrogen, not enough estrogen, because now we have serotonin low, melatonin low, but we have high estrogens. Now we have histamine that makes us more painful, more achy, we don't do as well, and we're awake at night because it's a stimulatory and we're not sleeping well. So
yeah, it's just like every little piece of the fire that could go into like, making it more intense and then like fueling it even more happens to so many. How many women can resonate with this type of thing? We hear it all the time, we see it all the time. We've dealt with our own journeys, right? So it's not like this is something new or different. And thankfully, I mean, we're getting to the point where people are having more conversations or we're getting more educated on this, which is amazing. But there's still just so much more work to be done and education to be had and conversations to continue having, because it's never going to be black or white.
No,
there's still going to be that individual piece of what's going on day to day or in this phase of life, but also what happened a few years ago or, a decade ago, or what's coming up, right? That your body's maybe proactively anticipating. There's just so many influences. And then if we add to this mix an actual musculoskeletal limitation.
Oh yeah, let's not forget we have structural stuff going on too. Yeah.
Exactly.
Yeah.
And this, I think, when we see a lot of clients that have done typical physical therapy or even like pelvic floor therapy. A lot of our clients, they've done pelvic floor therapy or had the surgeries, had the injections, like that are supposed to help.
Yep.
And either they don't help at all.
Yep.
Or if they do, there's not long-term like relief. It's like, yeah, it helps in the short term, but then it keeps coming back. That's where I'm like, okay, let's figure out what's going on with the joint, the muscle tissues, the dynamic control of the area. If there's any structural limitations, are things like impingement or labral tears actually causing the pain, or are they just present and the pain's actually being caused by these other inflammatory types of reactions, So understanding those pieces and how we don't want to ignore the movement piece or the structural piece, on how can we incorporate that into the other drivers that are keeping somebody in this cycle,
Oh, yeah. It's a lot. It gets to be a lot, right? And that's where the individual showing up, asking the questions, being involved, because there are so many factors that go into it. And then, right, we work hard with our women to not feed into the nervous system part by giving too much at once. And so it does take time to bring these factors in to go, okay, there is a structural piece. Let's work through that. What's going on with that? Okay, let's bring all of our heads together and figure this out. But we also have to bring down the overwhelm, which takes time to do little bits here and there.
Yeah. And I think one of my favorite pieces of what we do is the pelvic floor piece, but looking at it from an orthopedic standpoint.
Yeah.
And then that neuroplastic standpoint. Because I feel like for a lot of pelvic floor experiences, it's like, oh, you're tight or you're weak, or okay, breathe, learn how to breathe this or do this type of Kegel, and you should be good. And if it doesn't work, I don't know what else to do, type of thing. Yep. And so it's not actually structured to a lot of the women we treat are those active women, right? It's not like they're immediately postpartum or, they can't just control their bladder throughout the day. It's like they're otherwise active. They're doing all of these other pieces, but the pelvic floor is a huge aspect keeping them stuck in the cycle because of how the pelvic floor isn't orthopedically showing up to support the rest of the hip or the loading or the performance or whatever dynamics they're doing in their workouts. And then the brain is so tied to that pelvic floor from just the cortical structure standpoint, but from that neuroplastic standpoint and where we hold on to a lot of this, high achieving tendencies, these people pleasing tendencies, I'm going to put everybody else first and I'm going to do all the things to make sure everybody else feels good or feels comfortable, not realizing, hey, my body is actually holding on now to all of this and it's holding on deep into those muscles that we can't see or touch as easily.
Yes. And the pelvic floor ends up so much tighter than women realize because they're clenching all day. They're literally holding the weight of their world up by their pelvic floor, their kids, their husband, themselves, their job, their career. And yes, when you can't physically touch, feel, whatever, it's challenging. And what about the clients that are like, I don't feel anything in my pelvic floor, but we know that it's a mess.
Yeah.
So it's challenging, right? Those women that we work with, they come in and they use the wand and they try and they come back and go, Molly, I'm not feeling anything. Okay. To get them attached again into feeling what's going into their pelvic floor and how viable, like when they give it time and they use the wand a few more times and they really do the breath work and they really start to feel what they're feeling, it's like, oh, yes, I do have tension in my pelvic floor. But it can take time. It can take time. It's not a quick just get in there, use the wand, and then you're gone, right? Really be intentional into your body is one of the hardest things to do.
Yeah. And again, going back to what we talked about earlier, it's not just having the tool for one thing, right? Oh, the glutes tight, let's stretch it. Oh, pelvic floor is holding on. Okay, let's release it. It's like the sequence of what we're having somebody do together so that they're comprehensively learning to, support one another. And then also the mindset piece of what does this mean? Or what am I actually holding on to or ignoring that maybe my body keeps having these symptoms because it wants me to actually listen to it, understand it so that I can get that sense of safety or clarity again so that I can move forward and not just be so rooted in the past or rooted in a certain element that's keeping them stuck.
Yeah. And then it circles back to sleep, right?
Yep.
Oh gosh, man, if we're not sleeping and getting that repair, or when do we put in our pelvic floor work? Is it best for some people at night? Is it best for some people in the morning? Do we want the pelvic floor to be calmer in the morning so that we get some trickle over calm during the day? Or is it better for some women to do it at night? So, that part of the individual is figuring that out with people and trying this. So try that tool. Okay, that doesn't seem to be working. Let's shift and let's try this a different way. What does your body need to be able to feel safe and calm so that we can then trickle into sleep, bring down the cortisol, affect the hormones so that we're getting restorative sleep at night.
Yep. And then the hip feels better.
And then the hip feels better. Imagine.
It's amazing. It's amazing how that all works.
Then we're working on the pieces of all of it. And then we get the results of the hip feels better. And then that forward feeds all the other things.
Yeah.
It is. Yeah. It's such a cycle. Such a cycle.
Absolutely.
And it needs tools from all angles. And I think that's why the women that come into the program do well, or I know they do well with us because we put all those pieces in. And it's what's missing from so many things is that they're just working structural, or let's touch on the hormones. If you can find a provider that will actually listen to those those complaints. And they're becoming more and more, but it told us to, we gotta put all the pieces together. It's not just one here and one there.
Yeah. Yeah, I agree for sure. So what are, I guess, the biggest takeaways you want somebody to take away from this? Because obviously we've talked about a lot of very important things at a high level. Like there's so much more depth and we don't want to confuse people or make it like irrelevant. Some key takeaways are just that troubles with sleep or hip pain with sleeping are rarely just about the hip itself or the act of sleeping itself. There's so many other aspects that can be playing a role. And if we're living in a heightened nervous system state all day long, or if we're having different types of hormonal fluctuations, it's really, really hard for the body to feel like it can get that safety and that security to fully restore. And so making sure that we're understanding, hey, what could be going on with the hormones, the stress levels, or even just what our agendas look like throughout the day or throughout the week. How are we showing up and living our life? Where can we maybe add a little bit more of that rest and that support throughout the day, or how we think, so that we're just making sure our body feels like listened to throughout the day, so that it's not trying to catch up and get our attention at night.
So good. And then when you layer in kind of what's happening from a pelvic floor function standpoint, and you layer in the movement patterns of what might be going on structurally that's keeping people awake too, or just their fears and thought patterns through the day. And our minds can be really, really active at night too, if we're not sleeping, and how that feeds into everything. So yeah, it's a lot.
Yeah. And if you're somebody out there listening and just resonating with this, or feeling like you don't know where to go, or you've tried a lot of things, just know that there's usually something bigger or deeper going on, and we can do something about it. Yes. All right. We do have a free training where we talk a little bit more about kind of how we approach this a little bit more comprehensively, from the movement system, the pelvic floor, the nervous system influences, especially when there's been this nagging type of hip pain, and how it's affecting us throughout the day. So, you can check out that resource below, just to hopefully get a little bit more clarity, or, guidance on potentially what could be going on in your body and what to do next about it. So thank you for being here. Hopefully you've gotten a little more clarity on what's going on in your body and what it could be trying to tell you. Thanks, Holly.
Thank you. So that was so fun. Great conversation.